So over to you, Mark. You can begin to bring the video forward now for us.
Who will talk about those other elements, which was about those opportunities, etc., to actually access services and other components which cause issues. Kavita, can I hand over to you?
Hello, everybody. Thank you, Matthew. That was really informative. My name is Kavita Chapman, and I'm the head of EDI, Equality, Diversity and Inclusion, across the Southeast. I cover 33 organizations or providers, and I work with the 6 ICSs. Can everybody hear me? Yeah? I can only see 2 people in the screen, so I hope everybody's still awake.
You're fine, Kavita.
What Olivia and I are going to do, oh, hello. What Olivia and I are going to do now is we're just going to talk you through some slides, but basically what we've been doing over the last, since summer last year, is ensuring that all providers did risk assessments with their staff. So Olivia and I and the EDI team went out and we asked 3 questions. We asked, did you have a standard operating procedure in place for risk assessments? Do you have an electronic data capture to capture the information? Do you know or have a system in place for declines? And now we're asking them, do you have a system in place for when staff are at high risk? And have you reassessed them? So we've been doing some dedicated risk assessment work because we knew that in 6 months' time when we get a vaccine, this will be correlated with vaccination uptake. So we anticipated that in advance. So I'm going to introduce you now to Olivia King, who is the EDI specialist in the team, and she does a lot of work on strategy and vaccination now with public health. And she'll take us through our slides in terms of how we looked at the process around risk assessments and then vaccination, but something that Matthew was talking about in terms of behavioural de-risking. So that's the approach we took for the last year. Olivia, over to you.
Hi, my name's Olivia King and I work with Kavita and have been working with her on the issues that have arisen due to the pandemic and also risk assessment, standard operating procedures. So this is, we've just put together 3 slides. I just wanted to say that the work in these slides has to do with the support that we've been providing to the ICSs, the providers, and different teams across the NHS. And I've just summarised the key themes that we've captured since June last year. And this slide is just to highlight that the barriers to risk assessments and the barriers to vaccinations are actually really similar, and there are actually 3 core areas that they can be grouped under: confidence, complacency, and convenience. And Kavita, did you want to add anything to, I don't want to go through every single thing, but confidence is basically trust in the process. Part of the confidence issue is obviously about the wider environment, what's happening to local communities that our staff live in. So it's really difficult to distance staff experience from what's happening in their own homes and their communities. So another issue, something that was highlighted even today, is the way in which confidence gets eroded because of the way communication is currently working in this pandemic. There's not a lot that people can do because we're progressively learning more about how the virus works, but yet that tends to undermine or build upon the lack of trust in certain communities that was already there, specifically Black communities and Bangladeshi and Pakistani communities.
I think, Olivia, all I'd like to add is that when we used the behavioural de-risking approach, it was a very practical one. So in talking to every leader who was setting up the vaccine centres, it was about process mapping all the operations and thinking, what have you put in place to ensure that people have access to come and get a vaccine? So how are you ensuring that things like childcare, night shifts, all the things that are very, very practical for staff to access vaccines are there in place? people who work part-time. We talked about, Matthew talked about agency staff. Well, a lot of agency staff might have worked in the private sector and doing agency in our NHS. And how are we making it easy for them when they come to do shifts to take the vaccine? And are our vaccine centres flexible in their opening time? So we started from the basics with providers.
So that's in the area of convenience, and we continue to use this model of convenience, complacency and confidence to actually make it simple, because as lots of research and studies will show you, if you don't keep the message simple at a time where people are excessively anxious and there's a lot of fear, it's really difficult to break past the lizard brain and get to conscious engagement with what we're trying to do. So I'm just going to move on to talking about something that is equally important, and that's innovating in a compassionate frame of mind in terms of the understanding that we have in terms of human needs, human desires, and the hope. And the reason why we took this approach is because the NHS is extremely good at working really quickly to set up operating models that are practical, and as you can see, planning, getting vaccinations to the people when they need it. But there's another aspect of operations, and that is how we actually talk to the people who are most affected or most concerned about the vaccine and the impact on the community, not just in terms of health, but also the knock-on effect to their ability to look after their kids and put food on the table. So Kavita and I thought this would be a good slide to put up to get some viewpoints from you. So what do we actually think the people want or need from a vaccination program? And the 4 points that I've put up are actually the key issues that we captured when we ran 2 surveys, one in June about COVID-19 and the pandemic, targeted at our BAME population in the Southeast, asking them questions about access to PPE, how they felt about the risk assessment process. And we ran the survey again in October, and we found similar themes. So these are the four things that came up from our survey. So I just thought that this would be a good opportunity for everyone to share what they think might be additionally needed. The rest of the slides, and you'll be given the slide deck, gives you some research papers that we have written, and it includes the survey results. And so that might be helpful. If any of you need any of these resources, just contact me. So if I can open this up to discussion, what do you think people want or need from the vaccination program? And be really, sort of take a really human aspect or angle to this. People are concerned about how whether the vaccine will reach their children, whether the right vaccine is being used, you know, that all these kind of things that are important to address, and to reduce what was said earlier about the feeling of an imposition or top-down ask. It's really what happens when we do it that way is we increase stigma and increase exclusion, and people feel that the spotlight has been shown on their communities, for example, for not engaging.
So any questions? Olivia has taken the questions, not me.
Thank you, Mark.
So we're thinking in terms of better quality of information. I mean, people really need to feel a sense of freedom, especially with new
Back to you, Jeanette.
Thank you, Mark. So hi everyone. So we thought it was important because the vaccine program is going to be here with us for a long time. Vaccine hesitancy is still here, and that's going to have an impact on our people and our patients as well. And for those of us that are working in the well-being space, it's incredibly important. And I know in all your organizations, you've done your own videos by clinicians, non-clinicians, your networks. So it's really important for us to be able to tap into what's happening in terms of vaccine, and we thought we'd show a bit from that video, and then we will send a link out to you as well. So hopefully everybody's able to see the chat box. Before we move on though, is there any questions or anyone like to say anything around that? Please feel free to put it in the chat box, or you can just raise your hand and then unmute. Okay, so I can't see anything in the chat box. So I'd like to welcome Charlotte, who is here with us. Charlotte, hi. And I know Charlotte is here to speak to us about We Connected this week, but Charlotte actually did her medical training in East Sussex. So I'll let Charlotte introduce herself and then bring her slides up, and then these slides will be made available to you. But I felt that Charlotte had a fantastic offer, so we've brought her in today as well. Over to you, Charlotte.
Thank you, Jeanette. Yeah, I did my foundation in Hastings, and so I have lots of good memories, so it's nice to connect with some Southeast England people again. I'll just share my slides. There we go. Okay. Is that working? I've lost you, but can you see the?
Yes, we can. Thank you.
Perfect. Okay, great. So my name's Charlotte, and yeah, I'm currently working with the Heart Movement, and we've got a project called the Heart Bus, which is a wellbeing tour that we're offering it's all around the UK. So we've come to talk to you about it to see if it's something that interests any of you. A little bit about the Heart Movement. So we're a non-for-profit organisation dedicated to supporting people to live more balanced, connected and emotionally resilient lives. And we do this through mindfulness, heart intelligence training and listening spaces. And the Heart Bus is something that we're in response to the COVID-19 pandemic and the increasing mental health issue crisis in the UK. This is kind of a response to that, where we're touring around the UK, visiting a wide variety of different communities, offering free, practical, no strings attached wellbeing resources to people. And we'd love to come and visit any of you if this is something that would be helpful. We know that especially over the last year, the stress for the NHS staff has been very, very high. So it's a community that we're definitely interested in trying to target and give our offering to. So what our key offering is it's based around mindfulness practices, heart intelligence practices and listening spaces. This is a sort of a rough summary of what our offerings would be, but these can be adapted to how you think it would best suit your staff. But it's basically about giving sort of drop-in sessions throughout the day, and also creating a nourishing space for people to be able to come to and connect with others. What we aim for people that participate to learn is we'll give an overview of the science of mindfulness, some mindfulness activities that can be used throughout the day, and how to come back to the present moment. Breathing techniques that can help to switch the nervous system into the rest and digest, away from the sympathetic nervous system. How to cultivate happiness and positive emotions, a bit about sort of heart coherence, and we use so using real-time heart rhythm sensors that sort of it shows how your nervous system is being switched into the rest and digest mode, and so the giving you some real-time feedback of the impact of mindfulness, and just how to be more authentically listening to yourself and others. So this is just a bit of a picture of the inside of the bus. So we have a workshop space, and we have a kitchen where we'll be preparing some teas and soups. Because of obviously the COVID-19, we'll be making sure that it's COVID-19 safe, and limiting the numbers indoors to the rule of 6 at that time when that rule still applies. So we'll also be creating an outdoor space that will be covered weatherproof, so that we can, so yeah, there'll be a good number of people that'll be able to engage at any time. So the tour we're launching in Brighton at the end of May, and we'll be there for a couple of weeks, and in Eastbourne and Hastings, and moving up to London for a couple of weeks in June, and then we go further around the UK. I know that some of you are Brighton, Eastbourne based, but if you're more sort of South London, do reach out if this is something that interests you. If it's sort of it's London and the surrounding areas, so if it's more Kent that you are, we can see what we can do, and we might be able to visit some of those areas. So yeah, so if this is something that interests anyone, please do send me an email, and you can also look on our website, theheartmovement.org, and we're on Instagram and Facebook as well if you'd like to have a look, or just email me any questions or anything, and we can see what we can sort out. But thank you for listening.
Thank you so much, Charlotte. That's amazing. I want to get in the bus myself, actually. But I'll just pause here, and you will get the slides with Charlotte's contact details where you can contact her directly. Penny, is there any question in the chat box you want to highlight?
Yes, Catherine Cox has kindly raised the question. If it's okay with you, Catherine, I'm just going to sort of read it, paraphrase it. So Catherine has mentioned that she's booked 3 dates here for the Sussex Partnership. They're very excited about it, and they're going to make sure that they're going to work with the sites to ensure that the logistics are smooth. There's no booking system as she understands it, so perhaps you could confirm that, Charlotte. And also the question is asked, how will you manage flow? Okay, so for booking, it's best just, we don't have a form or anything. It's best just to contact myself via my email, and then we can go further about any details and get things confirmed. For flow, I'm guessing, do you mean if loads of people come at once? Yes. COVID, yes.
Yeah, I guess we'll have a number of staff to support to make sure that things are set out in a socially distanced way. And I guess it will be, because we'll be there sort of 9 to 5. Unfortunately, it may be the case that we'll have to say if it's okay to come back later, but we'll make sure that it's set up in a way that is COVID-19 safe. Yeah.
Thank you. So a couple of other questions coming in, Charlotte, if I may. So Adele is asking, is there going to be a cost to book you to come on site?
No, it's completely free. So yeah, no cost at all.
No cost at all. And I think that's it from what I can observe, unless anyone feels I've missed them out.
Lots of fantastic comments. Look, fab. Would be good to see you in Portsmouth. Yes. So you have an open invitation there. It looks fabulous, and we'll ensure we send the slides out. I mean, I just want to get in that bus. I mean, I live in Eastbourne, so Catherine, I'm serving notice in Sussex. No, but it's fantastic. And when Charlotte and I connected again this week, I thought I've just got to get her on here today, because it is another option. We know with the logistics it may not serve everyone depending on where you are, but again, we have some fantastic caring charities, and Charlotte, we just hope that you get the resources to carry this on and even to make it even bigger and better as well, because we know that the need will carry on. And then Roz is saying, fab idea, looking forward to seeing you across the Bob area. That's Buckinghamshire and that area there.
Yeah, well, yeah, thank you so much, and thanks so much for having me, and I'm glad that you're all excited. I look forward to connecting with lots of you as well. So thank you.
Thank you, Charlotte, and you are welcome to stay with us till 1, but if you need to go, we understand as well. So you're among friends.
Great, thank you.
You're welcome. I just want to pause here before I bring Alison in, just to say, is there anyone with us for the first time? If you just want to raise your hand and unmute so we can see who you are and welcome you. Oh, so we have Claire with us, and we have Sarah. So Claire, do you just want to introduce yourself and tell us where you work?
Thank you, Jeanette. Yes, so I work for Kenton Medway CCG as workforce and OD advisor. Fairly new into the role. My background is HR, but I'm quickly getting into the remit of OD. I'm quite an advocate for health and wellbeing, and because I believe that, you know, if you look after your people will look after your organisation. And for staff retention and reduction in absenteeism, I think, you know, this is the way forward. So it's lovely to meet you all, and Amanda, who I think normally comes to these meetings, has asked me to take some notes to take back to her. So that's me.
Thank you, Claire, and we'll add you to the list. You're welcome and you're among friends.
Thank you.
And Sarah, you Gage, did you want to say welcome?
Hi, I'm Sarah Gage. I work for NHS England and Improvement, System Improvement Support Manager, and I'm a recently appointed Freedom to Speak Up Guardian for NHS England and Improvement, and I have an interest in health and wellbeing in general as well. So Jeanette invited me to come and join the health and wellbeing group meetings, so it's nice to see you all.
Thank you, Sarah, and welcome. And we'll be hearing from Sarah in April. She'll come and present and let us know what's happening, and also as it links to wellbeing. And obviously Penny, our health and wellbeing manager, will connect with Sarah, because Penny's a Freedom to Speak Up Guardian as well. So we get 1 for 2 or 2 for 1, but anyway. So I'd just like to bring Alison in, and in terms of retention, as we know, our work is key in the wellbeing space to underpin retention. We've already started some exciting work, which Alison will tell you about, and there is an event coming up for us in the Southeast, and again, Alison will tell you. So Alison, as you get ready to bring your slides in, I will hand over to you.
Lovely, thank you, Jeanette. So I'm just going to start sharing slides, and can everybody see? Right. Yep, lovely. Okay, so just to introduce myself, my name's Alison Smith. I'm the retention manager for the South East region. I'm quite new in post, started on the 1st of February, but prior to that, I did actually work in the South East region in acute and mental health trusts. So just moving on to give you a bit of an introduction to the national retention team, which was newly formed last year, setting out to support the delivery of the People Promise. And we've since been building up a retention hub with resources and case studies from across the region. And this hub is available to everybody, and I will be sharing the links in the chat, as well as these slides will go out with the links on them to access the retention hub. So just to give you a flavour of some of the work that we're doing across the region, I've just picked up a few key things. One of the pieces of work is labelled the Pathfinder programme, and this began last year in 3 regions in England, looking at a 12-month programme working to identify the drivers and factors affecting retention. So the programme runs over 12 months. We're actually going to be starting the programme in the region with one system on the 1st of April. And the programme has been designed around a 90-day planning cycle, whereby we sort of gathered intel and information from various sources to understand the drivers affecting retention. And then during that period, a plan is pulled together, which will be implemented on the following 9 months. So as I say, we're in the early stages and we've got a lot of learning from the previous Pathfinders, but it's quite an exciting piece of work that we'll be linking in with the system in the region. The other piece of work that's going on nationally, and I'm quite excited to say there's 5 organisations within the South East that have actually signed up for this, is the Generational Retention Programme. So this programme looks at, it's following research that identified that staff tend to leave the NHS at sort of early stage and later stages in their career. And there's kind of some statistics, I won't go through them all, but we'll be working with the organisations to actually look at initiatives that we can put into organisations that will help support those staff in those early and later stages of career. The programme will include focus groups, and last month there was a break focus group held where it identified several themes where the programmes are going to be developed around, and there's some more events coming up later this month as well. The retention team have recently launched the Model Health, previously known as Model Hospital, retention compartment, and this was launched last month. Specifically with data designed around retention, and I've kind of given you a few snapshots of some of the information that you would see on there. One of the key items is around sort of information on leaver rates, turnover, sickness, as well as pulling data in from the staff survey, specifically around intention to leave. Now, the data on there at the moment is the 2019 staff survey data, but we will be updating in the next few weeks with the 2020 data. The good thing about this portal is that you can kind of pull information at an organisational level as well as a system level. So you can actually go onto your organisation and see where you sit with your peers. And there's a great report that comes off, and it pulls off all metrics. Where you'll be able to see exactly the breakdown around certain demographics as well. So if you're looking at your leavers, what are the age ranges and ethnicity as well? So really start to drill down and get some rich data on your organisation. Again, it's a bit short notice, but there is a webinar coming up on the actual retention compartment in Model Health tomorrow between 12 and 1:15, and I will be putting the link in the chat as well for that webinar if anybody at short notice is able to attend that. And the last thing I wanted to just talk about is something we're really excited about. We've set up a date now for our South East Region Retention Community of Practice event. So this is bringing together everybody that's got any passion around retention, whether it's in your role or you're just interested in retention, to join this unconference event. It's scheduled for Thursday the 10th of June. There'll be an afternoon session. We're in the process at the moment of pulling together the design team, which will help to develop key themes for the event, which will be open to actually anybody to join. So we're hoping to share the learning from this across the region and help shape the plans specifically for the region. And one little ask from me is that this is a great network that you have for your health and wellbeing leads, and I'm really interested to set up a network for retention leads within the organisation. So it's a bit of a call out from me. If you do have a named individual in your organisation that's leading on retention, you may be yourselves or someone else, if you could forward them over to myself, again, I'll put my contact details in the chat, and just let me know their names, job role and the organisation they're working in. And that's it from me. Does anybody have any questions?
So retention is a foundational part of our work, although we may not be leading on it. But the work we do in looking after our people and all the offers we have in our organisation is one of the things that will attract people and help people to stay. So we're really excited. I'm working very closely with Alison and Laura and a number of the other regions already setting up their events. So you'll be hearing more about that. But we really, really do need your help to identify who is leading on retention if it's not yourself in your organizations. And we, again, will be sending out the slides. So I'll pause here. Are there any specific questions for Alison? You can raise your hand and unmute.
There's nothing presently in the chat facility, Jeanette, and Alison has very kindly placed her contact information and other information in the chat facility. Thank you, Alison.
Okay, brilliant. Okay, so thank you for that, Alison. Fantastic, and we'll be hearing more, and we'll be coming back to you, and we will be writing out also on Friday. We will just give you a reminder to give us some feedback as well if you know who's leading on retention in your organization, because this is something we need to move at pace with as we're looking at the data coming forward, and we continue to look at the analysis data in the staff survey, which we'll talk about. Thank you. So at this time, I'll just pause here and then obviously open it up, and then Penny will come in as well. So we have asked you to fill in a survey. We have been together every week since January, bi-weekly, November, December. And we're looking at your feedback you've given us so far. So if you haven't had a chance to fill in the survey, asking about how you would like this group to go forward, if you'd like a specific community of practice as well, and the timings. And most of it, people are saying bi-weekly or monthly. So we will have a session next week, and Penny will tell you a little bit more about that. However, we won't have a session on the 6th of April. We're taking some time as a team to look at your feedback, look at the scheduling, look at the staff survey, and also to look at the information that's coming out from our national team. So we get the framework right for you as we go forward in Q1. But one of the things we want you to think about is we will be working on an event for our guardians. So to let you know, all of you who have helped us, we're 50% there, and we have 16 named guardians, and we need, it's 33 organizations, so we need 17 more. So if you do know the name of your guardian, can you please let us know? If you don't, can you start with your HRD or your OD lead if you're not sure, because we'll be having an event for them. Excuse me. And then I'm working with the national team to see if we can get a date for a wellbeing event. So once we get the date, because we'll probably hopefully get some support from Horizons again for that, I will come back to you to co-design that event. So these are some of the things we're hoping we can achieve together in Q1, but we really do need your help going forward in framing the bi-weekly or monthly sessions. So if I will pause here, are there any thoughts or reflections? Please pop them in the chat box, or you can feel free to raise your hand now and unmute. Everyone is very quiet today. We're very reflective. Yes, go ahead, Adele. Unmute. Yeah.
Just to say that it sounds great to have a wellbeing event in Q1. That sounds like a really good idea. Thank you.
Yeah, thank you. We are trying our best to get some available dates. So we should potentially have 3 events. The retention, the one where we will bring the wellbeing guardians, and the generic one. And so there are 3 core things for us: the wellbeing guardian, the wellbeing champions, which we're collecting the numbers, and the allies, because we also want to come back to them to say, what would support look like for you on top of the support you're getting from your organizations, and in fact you want your own community of practice or virtual space. And then there's the well-being conversations where we sent the slides last week, excuse me, and we'll be leading on some work there. So we've sent you the framework, and it's about how you go back into your organizations to embed that, but we need to have some further conversations about what support you would need. So these three key areas are merging in order to support the whole work that you're doing. Please keep the mindfulness, so we'll keep a note of that, Lisa. And also with the mindfulness, we'll look to colleagues, we'll look to videos, but please feel free to, if it's a session you would like to take on mindfulness, please let us know. And if there are other sessions you think that would benefit all of us and you would like to lead on that session, we'd also like to hear from you. I think we have Christina here as well, who you've been communicating with. We've had a huge team looking after our people, but we're in transition where Christina and some of colleagues from the lifelong leadership will transition back into their teams and talent. And so you'll be seeing Christina still hopefully on the Tuesdays, but a lot of the communication from April will come from Penny. Christina, is there anything you wanted to say as you're with us in the space?
Really just to say thank you to everybody. You've been very, very helpful when I've asked for something at short notice. And it's just been very, very useful to have all those conversations. So we are still here. We may be in the background doing different things, but if you can't, if you need to get hold of somebody quickly, you will know where I am. So drop me a line, drop me a note, and I can at least try and help and support and get to the right person as quickly as possible for you. But no, thank you very much for all of your help and support.
And thank you, Christina. And I know some of the narrative and the information you've got will support your other work that you're doing with colleagues in Lifelong. So none of the information or intelligence we have gathered has been lost. Thank you. So Penny, I'll give over to you now. I know you want to say a bit about perhaps next week and what's to come. So over to you.
Thank you very much, Jeanette. Yes, I just want to second my thanks to Christina for all the wonderful work and support as we move through this transition period. Just a little bit of news about next week's presentation. It's going to be about 20 minutes long, and it's going to be a session on actual physical health whilst seated at your workstations at home. It's not going to be anything akin to doing the London Marathon, so please don't have any worries about it. Just some gentle stretching exercises, things which are good for the ankles, the wrists, which are going to help support posture, and also to rest your eyes because of the ocular demand on the eyes upon looking at not just our computer screens, but all the devices that we use around work, from laptops to Kindles to mobile phones and this, that and the other. So we're going to have that. It will also be presented by a colleague here in the NHS, and also will come with some slides which you can take away with you, so you can have constant referral to those, as well as the signposts about all the NHS apps and facilities that we have in respect of physical health and well-being. So as I say, nothing akin to doing a marathon itself, but just as something that you could do perhaps quietly whilst you're in a Teams meet, rotating your ankles, and no one will be asked to do any demonstrations, and if you don't wish to take part, you just wish to sit and listen with your camera on and off, then you may feel free to do so. So we're looking forward to bringing that to you next week. So that's going to be Tuesday the 30th of March.
Thank you, Penny. And also Penny will probably have some updates for you as well in terms of a national and a regional perspective. So before we wrap up, it would be lovely to see some of you, if you can put your camera on. Would be great to see you. And just to say, is there any reflections, anything you want us to know that's particularly happening in your neck of the woods? Any good news, anything, any support needed? It's so fantastic to see all your faces. Wait. So there no feedback on anything? How, I know a lot of you are working on your programs. So it's all going well. Okay, brilliant. So without further ado, I know obviously we may be able to claw back some time for our lunch or teas or coffee. Yes, Adele, come in. Yeah.
Sorry, Jeanette, I won't share now, but I just wanted to check. I sent you an email just about some feedback about the session we did on listening spaces, and I just wanted to check that you'd got that.
Yes, I've got that, and I was going to respond to you. So thank you, Adele. Yes, it's in my to-do list.
Thank you.
Yeah. Is there anyone else that I've missed? Any other queries? Okay, so yes. So is there another hand raised?
Yeah, Jeanette, it's Ros.
Yes, Ros, come in.
I just wanted to just share something really. I've just done a webinar at 12 o'clock, quarter to 12 o'clock, so that's why I was late. But I'm just wondering if the group, because it is reflection day and thinking back, that's why the group's quiet, certainly had that impact in our organisation, that there just seems a different atmosphere really today, and it's folk like all of us in this call who have been doing things in autopilot, and actually today, even right up to the minute we were going live with the webinar, we hadn't really thought about it in the depth that a lot of people do, and I'm just wondering if that's a bit of a reflective thing going on. That was all I wanted to share.
Thank you. Yeah, it's definitely happening. Because I'm in between two worlds at the moment, and you know, have lost a number of colleagues, so they're very much on my mind today. So yeah, and I just thank everyone in the midst of that for coming in, and I do hope that you've had some space for yourself